Hi, everyone. Welcome to the Lacked Fact Weekly Podcast, which highlights recent clinically relevant research, policy statements, and protocols that you, as a practicing lactation professional, would probably like to know about. I'm your host, Dr. Ann Eglash. I'm a board-certified family physician and breastfeeding and lactation medicine specialist at the University of Wisconsin School of Medicine and Public Health. This podcast is written and produced by the nonprofit organization IABLE, which is the Institute for the Advancement of Breastfeeding and Lactation Education. We have no commercial funders for this podcast series. Today's Lacked Fact comes from the long-awaited systematic review on breastfeeding and health outcomes for infants and children, published in March 2025 by the United States AHRQ, which is the Agency for Healthcare Research and Quality. The last review on the benefits of breastfeeding for infants and children was in 2007, and there has been a great deal of research since then. For this report, the researchers primarily relied on already existing systematic reviews, in addition to newer primary studies that were not included in the systematic reviews. The number of studies for each infant and child health outcome in association with breastfeeding varied, anywhere from 6 to more than 180 studies. The data for each health outcome was rated as either low or moderate strength of evidence. And here's what they found. For otitis media, there's moderate strength of evidence for a 33 to 43% reduced risk of otitis media associated with ever breastfeeding and longer durations of any and exclusive breastfeeding, particularly under 24 months of age. Asthma also has moderate evidence showing a 6 to 31% reduced risk of asthma in childhood between the ages of 2 and 12 years of age, with longer versus shorter durations of any or exclusive breastfeeding. Childhood obesity was a topic that had the greatest number of systematic reviews, which was a whopping 159. They found moderate evidence with a 15 to 34% lower risk of overweight and obesity in children ages 2 to 12 years of age associated with more versus less breastfeeding. They estimated a 4% reduction in the risk of obesity for every additional month of breastfeeding. Childhood cancer research also has moderate evidence showing a 10 to 23% reduced risk of childhood leukemia with ever versus never breastfeeding, but no clear association for other cancer types. Respiratory infections, despite there being 16 systematic reviews and 35 recent primary studies on the effect of breastfeeding and respiratory infections, the evidence is considered low strength, with potential reduced risk of more severe respiratory infections associated with breastfeeding, particularly among infants under 24 months of age. Diarrhea and GI infections also has low strength of evidence for reduced risk of moderate to severe GI infections and breastfeeding at lower ages, particularly in infants under 6 months. This was shocking to me because it is extremely uncommon to see exclusively breastfed infants with significant GI infections. Allergic rhinitis shows there's evidence that there's low strength of evidence for reduced risk of allergic rhinitis associated with more breastfeeding. There's also low strength of evidence for malocclusions, with a potential reduced risk of malocclusions associated with any or exclusive breastfeeding with inconsistent evidence on breastfeeding duration. There's a potential reduced risk of inflammatory bowel disease associated with lower duration of breastfeeding, but the strength of evidence is low. There's also low strength of evidence for a potential reduced risk of type 1 diabetes in children under age 18 associated with more breastfeeding. There's low strength of evidence for a lower risk of accelerated growth and rapid weight gain in infancy and early childhood associated with more breastfeeding. So in other words, children who are breastfed are less likely to have very rapid weight gain and accelerated growth. However, the evidence is low strength. And there is a potential for reduced risk of systolic high blood pressure in infants and children who are breastfed, and this also has low strength of evidence. Regarding infant mortality, there's a potential reduced risk of infant mortality associated with breastfeeding initiation, including risk of late neonatal mortality and sudden unexpected infant death, and the strength of evidence is low. Regarding cognitive development, this was surprising. They felt that there was moderate strength of evidence, that there's no clear association between breastfeeding and cognitive ability at any age. There's also low strength of evidence for no association between atopic dermatitis and breastfeeding, as well as between celiac disease and breastfeeding. And to go in the opposite direction, the researchers felt that there was moderate strength of evidence for increased risk of dental cavities or caries associated with breastfeeding 12 months or longer. And there was insufficient strength of evidence to determine if there is any association between breastfeeding and food allergies, as well as between breastfeeding and type 2 diabetes. So the outcomes of this report are fairly similar to their 2007 report, although this latest report includes research on allergic rhinitis, malocclusions, and inflammatory bowel disease. They also acknowledge strength of evidence, which they didn't do in 2007. This March 2025 report did not include infants who are under 37 weeks gestation, so they don't address the health outcomes of premature infants in association with breastfeeding. The authors of this AHRQ systematic review acknowledge that there have been problems with the definition of breastfeeding, how breastfeeding is measured and reported, and not controlling confounding factors. Because of limitations, the authors state that they were not able to identify a precise dose of breastfeeding associated with reduced risks, which is a common question asked by many parents. So if a parent asks a question such as, how long do I need to breastfeed to prevent my infant from getting inflammatory bowel disease, we can simply say that we just don't have that data. Hey everyone, thanks for listening. I encourage you to check out IABLE at lacted.org, which is LACTED.org, to learn more about our educational projects, courses, educational handouts, videos, live conferences, and webinars. By becoming a member, you are not only supporting our free projects, but you will also receive a series of benefits which you can learn about at our website. I'll be back with another LACT fact in a few weeks.